Leptospira, which causes a disease known as leptosporiosis. Now, this is broadly one of the types of spirochetes. Spirochetes are spiral organisms. Now, this spirochete is actually tightly coiled. Now, at the end of it, what you can see is a hook. Now, this organism is poorly stained with dyes, but it can be seen under dark field microscopy. Now, the pathogenesis of this organism include that it consists upon a genus which is known as Leptospira interrogans. Now, this organism is mostly prevalent in rainy seasons or in tropical areas where it rains a lot. Now, this organism is present within the livestock, the rodents, as well as in the house pets. This organism is excreted from these pets in the urine. So if this urine comes in contact with the food these animals urinate somewhere along small ponds or rivers, this organism can get into those areas where human contamination can occur. So if somebody is swimming in such a contaminated water, what would they would get the infection. And similarly, humans are also one of the reservoirs which carry this organism, but there is no human to human transmission. It can also affect the humans by taking such food or drinking such milk that is actually contaminated by such organism. Now, this organism mostly affects certain occupational groups such as the miners, farmers, or the people or the person which works in sewers. Now, when it is ingested, it actually passes through the mucous membrane. Similarly, it affects the human being, or it is being ingested in the food or drinking water. So what happens is from there it can disseminate into the blood and it can manifest as a biphasic illness. In the early phases, the patient have non-constitutional symptoms such as fever, headache, chills, and conjunctival suffocation, meaning your conjunctiva is so red. It looks like it's having a conjunctival injection. Now, these features resolve for a short period, but they manifest in a very drastic thing, that is an immune phase, in which it can result in infection of serious important organs such as the brain, causing aseptic meningitis in which the CSF around the brain is being infected. It can also cause liver damage leading to jaundice, and it causes impaired function of the kidneys, meaning your creatinine and urea gets raised. Now, another thing, how do we diagnose such a disease? We can diagnose such a disease by history. If the patient has a history of doing such a certain thing by which the patient had developed these symptoms that really progressed to this symptom. And we can do serology. Serology, what we see is we can see IgM titer being increased, and we can also get the organism in blood by doing a dark microscopy. So what we see is a tightly coiled spirochete with a hook on it, and we can also find this in urine. Now, the treatment for such organism is actually penicillin G, which is in affected patients, and the patients who are being exposed, we can give the patient doxycycline.